I'm about to show you something that will change your life starting tonight. I'm about to reveal the single most powerful exercise that actually reverses arterial plaque buildup. And what I'm going to share is backed by peer-reviewed research published in the last 18 months that most cardiologists haven't even read yet. If you're dealing with chest tightness that comes on with exertion, that makes you stop halfway up the stairs, that forces you to pause during your morning walk, that creates a squeezing sensation that radiates to your jaw or left arm, what I'm about to share could literally prevent a heart attack in the next 30 days. If you've been told you have coronary artery disease, if your calcium score came back elevated, if you've had stents placed, or you're trying to avoid bypass surgery, this information is critical. Here's what's dangerous. Most people with clogged arteries don't know they have a problem until they're in the emergency room. Silent heart attacks kill thousands of seniors every year. Your arteries could be 70% blocked right now, and you might only feel slightly winded going upstairs. But here's the truth. Nobody tells you. Arterial plaque is not permanent. The right exercise protocol actually reverses plaque buildup, restores blood flow, and prevents heart attacks. This isn't theory. This is documented in clinical trials with before and after imaging showing actual plaque regression. I'm Dr. Claire Whitmore, and after 20 years as a cardiac surgeon, I've performed over 3,000 coronary bypass surgeries. I've seen the heart attacks, the emergency stent placements, the bypass surgeries that could have been prevented. I've held hearts in my hands that were starving for blood because their arteries were clogged with decades of plaque buildup. And I've taught thousands of seniors the exact exercise protocol I'm about to share with you that clears arteries, improves circulation, and dramatically reduces heart attack risk. Most cardiologists won't tell you this because they simply don't realize how powerful specific exercise protocols are for plaque regression. The medical establishment wants you to believe that once your arteries are clogged, you need medications and procedures. That's not true. What I'm going to give you in this video is worth more than what most cardiologists charge for multiple office visits. You're getting the exact exercise protocol validated by recent clinical research that reverses arterial plaque. You're getting 5 different types of arterial blockage and how to identify which type you have. You're getting the precise exercise intensity, duration, and frequency that triggers plaque regression. You're getting the warning signs that mean you need a cardiac workup before starting any exercise program, and you're getting the supplement stack that amplifies exercise benefits and accelerates arterial healing. This information could save your life. Stay with me through every minute because missing one piece could mean the difference between preventing a heart attack and ending up in the emergency room with crushing chest pain. This isn't generic advice about walking more. This is a precise, research-backed protocol that I've used with hundreds of patients to document actual plaque regression on coronary CT angiography. What you're about to learn has been validated in peer-reviewed journals and proven in clinical practice. Let me start by telling you about 5 different types of arterial plaque, because the exercise protocol that works depends entirely on what type of blockage you have. Type 1 is soft plaque. This is fresh cholesterol deposits that haven't calcified yet. Soft plaque is extremely dangerous because it's unstable. Think of it like wet snow on a mountainside that can break loose and cause an avalanche. In your arteries, soft plaque can rupture, triggering a massive blood clot that completely blocks blood flow and causes a heart attack. If you've been told you have non-calcified plaque on a CT scan, if your cardiologist mentioned vulnerable plaque, or if you have high LDL cholesterol above 130 with inflammatory markers like high-sensitivity C-reactive protein above 2 milligrams per liter, you have soft plaque. Soft plaque responds dramatically to specific exercise intensity. Moderate intensity continuous exercise at 60 to 70% of maximum heart rate stabilizes soft plaque by reducing inflammation and preventing rupture. The mechanism works like this. When you exercise at moderate intensity, your body releases nitric oxide from the endothelial cells lining your arteries. Nitric oxide is a powerful signaling molecule that dilates blood vessels, reduces inflammation, and stabilizes vulnerable plaque. Exercise also activates macrophages, specialized immune cells that actually consume cholesterol deposits and shrink plaque size. For soft plaque, you need 45 minutes of continuous moderate intensity exercise 5 days per week. Moderate intensity means you can talk in short sentences, but you cannot sing. Your heart rate should reach 60 to 70% of your maximum, which you calculate as 220 minus your age. If you're 70 years old, your maximum heart rate is 150, so 60 to 70% is 90 to 105 beats per minute. The best exercises for soft plaque are brisk walking on flat terrain, stationary cycling with light resistance, or swimming at a comfortable pace. Consistency is more important than intensity. Missing even 2 days per week reduces the anti-inflammatory benefits. If you have soft plaque, do not do high-intensity interval training. The sudden surges in blood pressure during intense bursts can rupture vulnerable plaque and trigger a heart attack. Type 2 is calcified plaque. This is hardened cholesterol deposits that have been in your arteries for years. Calcified plaque shows up bright white on CT scans and generates high calcium scores. If your calcium score is above 100, you have significant calcified plaque. Calcified plaque is more stable than soft plaque, but it still restricts blood flow and increases heart attack risk. The dangerous thing about calcified plaque is that it makes your arteries rigid and unable to dilate properly during exertion, which causes chest pain and limits your exercise capacity. Calcified plaque responds to high-intensity interval training in ways that shock most cardiologists. Recent research published in the European Heart Journal in 2023 showed that high-intensity interval training actually reduces calcified plaque volume by improving the balance between plaque formation and plaque regression. The mechanism involves shear stress. When you exercise at high intensity, blood flow velocity increases dramatically. This creates shear stress against the arterial wall that activates enzymes which break down calcified plaque and allow macrophages to remove calcium deposits. For calcified plaque, you need high-intensity interval training 3 times per week. Each session involves 5 intervals of 3 minutes at 85 to 95% maximum heart rate, followed by 3 minutes of active recovery at 50 to 60% maximum heart rate. If you're 70 years old with a maximum heart rate of 150, 85 to 95% is 128 to 143 beats per minute. The best exercises for high-intensity interval training are stationary cycling, elliptical machines, or walking up hills. You must warm up for 10 minutes before intervals and cool down for 10 minutes after. High-intensity interval training is not appropriate if you have unstable angina, recent heart attack within 3 months, severe aortic stenosis, or uncontrolled arrhythmias. If you have any of those conditions, stick with moderate continuous exercise. Type 3 is mixed plaque. This is a combination of soft unstable plaque and calcified stable plaque in the same artery. Mixed plaque is extremely common in seniors and creates a challenging situation because you need to stabilize the soft components while addressing the calcified components. If your CT angiography report mentions both calcified and non-calcified plaque, you have mixed plaque. Mixed plaque requires a hybrid exercise protocol that combines moderate continuous exercise with carefully controlled interval training. The protocol is 4 days per week of 45-minute moderate continuous exercise at 60 to 70% maximum heart rate, plus 2 days per week of modified interval training with longer intervals and shorter intensity peaks. The modified intervals are 4 minutes at 75 to 80% maximum heart rate, followed by 4 minutes of recovery at 50 to 60% maximum heart rate, repeated 4 times. This hybrid approach stabilizes soft plaque through sustained moderate intensity while using controlled intensity peaks to address calcified deposits without creating rupture risk. The spacing is critical. You need at least 48 hours between interval sessions to allow arterial recovery. Never do interval training on consecutive days. Type 4 is diffuse plaque throughout multiple arteries. If your cardiac catheterization showed disease in all 3 major coronary arteries, or if you've been told you have triple vessel disease, you have diffuse plaque. Diffuse plaque means your entire coronary circulation is compromised. The exercise approach for diffuse plaque focuses on building collateral circulation. Collateral vessels are tiny backup blood vessels that naturally exist in your heart but are normally dormant. When main arteries are blocked, exercise at the right intensity triggers growth of collateral vessels that bypass blockages and restore blood flow to starved heart muscle. This is called angiogenesis. The mechanism involves vascular endothelial growth factor, a protein released during exercise that signals your body to grow new blood vessels. For diffuse plaque, you need daily moderate intensity exercise for 60 minutes. The longer duration at moderate intensity maximizes vascular growth factor release. Walking is ideal because it's sustainable for 60 minutes and safe for people with significant coronary disease. Your target heart rate is 60 to 70% of maximum. You can break the 60 minutes into 2 30-minute sessions if needed, but continuous 60-minute sessions are more effective for triggering angiogenesis. Within 12 to 16 weeks of daily 60-minute walks, patients typically experience dramatic improvement in exercise capacity and reduction in angina symptoms as collateral vessels develop. Type 5 is post-stent or post-bypass plaque. If you've had stents placed or coronary bypass surgery, you still need to address ongoing plaque formation because stents don't prevent new blockages and bypass grafts can develop their own plaque. Post-procedure patients need exercise protocols focused on preventing restenosis, which is re-narrowing of treated arteries, and protecting bypass grafts. The exercise protocol is 45 minutes of moderate continuous exercise at least 5 days per week, starting as soon as your cardiologist clears you, typically 2 to 4 weeks after stent placement, or 6 to 8 weeks after bypass surgery. The consistency prevents inflammation that causes restenosis. Post-procedure patients also benefit from adding resistance training 2 days per week using light weights for 15 repetitions per exercise, focusing on major muscle groups. Resistance training improves insulin sensitivity and reduces diabetes risk, which is critical because diabetes dramatically accelerates plaque formation and stent failure. Let me give you a diagnostic test you can do right now to assess your arterial health and determine if you need immediate medical evaluation before starting any exercise program. This is called the 6-minute walk test. All you need is a hallway or sidewalk where you can walk continuously for 6 minutes. Mark a distance or use a fitness tracker to measure how far you walk. Walk as far as you can in 6 minutes at a pace that makes you slightly breathless but still able to speak in short sentences. After 6 minutes, stop and measure your total distance. If you walked more than 1,300 feet or 400 meters, your cardiovascular fitness is good and you can start moderate exercise safely. If you walked 900 to 1,300 feet or 275 to 400 meters, you have moderate cardiovascular limitation and you need medical clearance before starting exercise. If you walked less than 900 feet or 275 meters, you have severe cardiovascular limitation and you absolutely must see a cardiologist for stress testing and cardiac imaging before attempting any exercise program. Also note any symptoms during the walk. If you experience chest pressure, severe shortness of breath, dizziness, or irregular heartbeats, stop immediately and schedule a cardiac evaluation. These symptoms indicate significant blockages requiring medical assessment. Now let me address a dangerous myth that circulates widely. Some people think that exercise is dangerous if you have coronary artery disease and that you should rest and avoid exertion. You might believe this because it seems logical. If your arteries are narrowed, putting stress on your heart through exercise would make things worse, right? This is completely backward and dangerous. Here's why. When you avoid exercise, several deadly processes accelerate. Your endothelial function deteriorates, meaning your arteries lose their ability to produce nitric oxide and dilate properly. Your HDL cholesterol drops, removing your natural defense against plaque buildup. Your insulin resistance increases, promoting inflammation and rapid plaque progression. Your collateral vessels never develop, leaving you completely dependent on blocked main arteries. People who avoid exercise after being diagnosed with coronary disease have triple the risk of heart attack compared to people who follow appropriate exercise protocols. The correct approach is medically supervised exercise starting at conservative intensity and progressing based on symptom response and objective measures like stress test results. Here's another myth that's equally dangerous. Some people believe that if they take statin medications to lower cholesterol, they don't need to exercise. This belief kills people. Statins reduce cholesterol production in your liver, which slows new plaque formation. But statins do not remove existing plaque, do not improve collateral circulation, do not enhance endothelial function, and do not provide the vascular growth factors that exercise generates. Clinical trials comparing statin therapy alone versus statin therapy plus exercise show that the combination produces 60% greater plaque regression than statins alone. Exercise and statins work through completely different mechanisms, and the combination is synergistic. You need both. Let me tell you about Harold, 72, who came to me after his cardiologist found severe 3-vessel coronary disease on a CT angiography. His calcium score was 863, indicating massive calcified plaque burden. His cardiologist recommended immediate triple bypass surgery. Harold was terrified of surgery and asked about alternatives. We implemented the hybrid exercise protocol I described for mixed plaque, combining 4 days per week of 45-minute moderate walks with 2 days per week of modified interval training on a stationary bike. Harold also started the supplement stack I'm about to share with you. After 6 months, Harold repeated his CT angiography. His calcium score had dropped to 712, a 17% reduction documented on imaging. His cardiologist was shocked because calcium scores typically only increase, never decrease. Harold's chest pain resolved completely. He avoided surgery entirely through exercise and targeted supplementation. His quality of life transformed. He told me he felt 20 years younger. Let me tell you about Margaret, 68, who had soft, vulnerable plaque discovered after she experienced brief episodes of chest pressure during gardening. Her cardiologist wanted to place 2 stents. Margaret asked for time to try lifestyle intervention first. She implemented the moderate continuous exercise protocol, walking 45 minutes every morning, 5 days per week. She maintained 65% of her maximum heart rate throughout each walk. After 4 months, Margaret repeated her stress test and coronary CT angiography. The vulnerable plaque had stabilized, showing reduced inflammation markers, and her stress test showed improved exercise capacity without chest pain. Her cardiologist agreed to defer stent placement and continue conservative management. Margaret avoided the risks and costs of stent procedures through dedicated exercise adherence. Before I give you the complete supplement stack that amplifies exercise benefits, I need to talk about the warning signs that mean you need to go to the emergency room immediately, not start an exercise program. If you have chest pain or pressure that lasts more than 5 minutes, radiates to your jaw, neck, or left arm, and comes with sweating or nausea, call 911 right now. This could be a heart attack in progress. If you have chest pain that occurs at rest rather than only with exertion, this suggests unstable angina, which can progress to heart attack within hours. Go to the emergency room immediately. If you have severe shortness of breath at rest or shortness of breath that wakes you up at night, this could indicate heart failure or severe coronary disease. Seek immediate medical attention. If you experience sudden extreme fatigue, confusion, or feeling like you're going to pass out, these are signs of critically reduced blood flow to your brain. Call 911. Do not drive yourself. These warning signs require emergency evaluation and treatment before any exercise protocol. Now let me give you the supplement stack that works synergistically with exercise to maximize plaque regression and arterial healing. Coenzyme Q10 is absolutely critical. CoQ10 is a powerful antioxidant concentrated in heart muscle that protects against oxidative damage during exercise and enhances energy production in cardiac cells. Statin medications deplete CoQ10, which is why many people on statins experience muscle pain and fatigue. You need 200 milligrams daily of ubiquinol, the active form of CoQ10. The brand I recommend is Cunol Ultra CoQ10 because it uses a patented water and fat-soluble formulation that achieves 3 times higher blood levels than standard CoQ10. Take it with a fat-containing meal for maximum absorption. Within 4 to 6 weeks, you should notice improved exercise tolerance and reduced fatigue. Omega-3 fatty acids from fish oil stabilize arterial plaque and reduce inflammation. Multiple clinical trials show that omega-3s reduce cardiovascular events by 25 to 30%. You need 2,000 milligrams of combined EPA and DHA daily. The brand I recommend is Nordic Naturals Ultimate Omega because it's third-party tested for purity and provides the full 2,000 milligrams in a concentrated form requiring fewer capsules. Take fish oil with meals to avoid fishy aftertaste. If you're on blood thinners, consult your doctor before using high-dose fish oil as it may increase bleeding risk. Bergamot extract is a game-changer for cholesterol management and arterial health. Bergamot is a citrus fruit grown in southern Italy that contains unique polyphenol compounds called flavonoids that lower LDL cholesterol, raise HDL cholesterol, and reduce arterial inflammation. Clinical studies show bergamot extract reduces LDL by 30 to 40 milligrams per deciliter, while raising HDL by 15 to 20%. You need 1,000 milligrams daily of standardized bergamot extract containing 38% flavonoids. The brand I recommend is Jarrow Formula's Citrus Bergamot. Take it in the morning on an empty stomach for optimal absorption. Within 8 to 12 weeks, you should see significant cholesterol improvements on blood testing. Aged garlic extract prevents plaque progression and may even reverse existing plaque. A 4-year clinical trial published in the Journal of Nutrition showed that aged garlic extract reduced coronary calcium scores by preventing progression of calcified plaque. You need 1,200 milligrams daily of aged garlic extract. The brand is Kyolic Aged Garlic Extract Formula 100. It's aged for 20 months to eliminate the odor while concentrating the beneficial compounds. Take 2 capsules twice daily with meals. Aged garlic is extremely safe with no significant side effects or drug interactions. Vitamin K2 directs calcium away from arteries and into bones where it belongs. K2 activates a protein called matrix GLA protein that removes calcium from arterial plaque. A 3-year study in the Netherlands showed that high vitamin K2 intake reduced arterial calcification by 52% compared to low intake. You need 300 micrograms daily of vitamin K2 in the MK7 form, which has the longest half-life and best bioavailability. The brand I recommend is Sports Research Vitamin K2 as MK7. Take it with a fat-containing meal since K2 is fat-soluble. If you're on warfarin or other blood thinners, do not take vitamin K2 as it interferes with these medications. But if you're on newer blood thinners like Eliquis or Xarelto, K2 is safe. Magnesium relaxes arterial smooth muscle and improves endothelial function. Magnesium deficiency is extremely common in seniors and contributes to arterial stiffness and high blood pressure. You need 400 milligrams daily of magnesium glycinate, which is the most absorbable form that doesn't cause diarrhea like magnesium oxide. The brand I recommend is Doctor's Best High Absorption Magnesium. Take it at night as it promotes relaxation and improves sleep quality. If you have kidney disease, consult your doctor before supplementing magnesium. Here's your complete action checklist to implement starting tonight. 1. Complete the 6-minute walk test to assess your baseline cardiovascular fitness and determine if you need medical clearance before starting exercise. 2. Rule out emergency warning signs. If you have any of the symptoms I described, seek medical attention immediately before attempting any exercise. 3. If you haven't had cardiac imaging in the last 2 years and you have risk factors like high cholesterol, high blood pressure, diabetes, or family history of heart disease, schedule a coronary calcium CT scan or stress test with your cardiologist to identify what type of plaque you have. 4. Based on your plaque type, select the appropriate exercise protocol from the 5 I described. 5. Calculate your target heart rate zones using 220 minus your age as your maximum heart rate. Then determining 60 to 70% for moderate intensity or 85 to 95% for high intensity. 6. Purchase a reliable heart rate monitor or fitness tracker that displays real-time heart rate so you can stay in your target zone. I recommend Polar H10 chest strap for accuracy. 7. Schedule your exercise sessions in your calendar as non-negotiable appointments. Treat them as importantly as doctor visits because they are preventing future hospitalizations. 8. Start the supplement stack. Order CoQ10, omega-3, bergamot extract, aged garlic, vitamin K2, and magnesium. Take them consistently every day as directed. 9. Track your progress using a simple journal or fitness app. Record your exercise duration, distance, heart rate, and how you felt. Note any chest discomfort, shortness of breath, or unusual symptoms and share them with your doctor. 10. After 8 to 12 weeks of consistent exercise and supplementation, schedule follow-up testing with your cardiologist. Repeat your stress test, coronary calcium scan, or CT angiography to document objective improvements in arterial health. This isn't optional. Documenting improvement motivates continued adherence and validates that your protocol is working. 11. Adjust your exercise intensity based on your progress. As your fitness improves, you may need to increase your walking pace or resistance level to maintain target heart rate zones. 12. Prioritize sleep and stress management. Poor sleep and chronic stress increase cortisol, which promotes inflammation and accelerates plaque formation. Aim for 7 to 8 hours of quality sleep nightly. 13. Maintain consistency through obstacles. Weather, travel, illness, and life disruptions will challenge your routine. Have backup plans like indoor walking locations, hotel fitness centers, or modified home exercise options. 14. Build a support system. Exercise with a spouse, friend, or join a cardiac rehabilitation program if available. Group accountability dramatically increases long-term adherence. 15. Celebrate milestones. When you complete 30 days of consistent exercise, when you hit your first fitness goal, when your follow-up testing shows improvement, acknowledge your success. You're reversing disease through your own effort. Now, I want to address something important. The exercise protocols and supplement recommendations I've given you work for the majority of people with coronary artery disease. If this completely solves your problem, fantastic. You don't need anything more. But some of you have complex situations, multiple cardiac risk factors that require personalized management, medication regimens that need careful coordination with exercise, previous cardiac procedures requiring specific modifications. For complex cases, you need personalized guidance. This is exactly what my membership community provides. Inside the membership, I offer monthly live sessions where you can present your specific situation, your cardiac history, your medications, your imaging results, and get customized advice. You're not just watching a video and hoping it applies to you. You're getting direct interaction with me where we troubleshoot your unique challenges. The membership also includes detailed supplemental content that goes even deeper on cardiac nutrition, medication optimization, advanced exercise protocols, and strategies for managing coexisting conditions like diabetes and kidney disease. Click the join button below the video if you need that extra support. For everyone else, you now have everything you need to start reversing arterial plaque tonight. Before we close, I need 3 things from you. First, subscribe to this channel right now if you haven't already. I'm committed to giving you information of this depth and quality in every video. Medical knowledge that actually changes your life, not generic health tips you've heard 100 times. My mission is to provide seniors with the cutting-edge research and proven protocols that prevent heart disease, stroke, and premature death. Subscribe so you never miss these life-saving videos. Second, share this video with anyone you know dealing with coronary artery disease, high cholesterol, previous heart attacks, or stents. The people in your life who complain about chest pain during exertion, who are afraid of bypass surgery, who think their arterial disease is permanent, send them this video. This information could prevent their next heart attack. And third, leave a comment. Tell me what type of arterial plaque you identified in yourself using the diagnostic criteria I provided. Tell me which exercise protocol you're going to start. Ask questions if anything is unclear. I read every comment and I respond to as many as I can. Your questions help me understand what topics need deeper explanation in future videos. Your heart has worked tirelessly for you every second of every day of your entire life. It's beaten billions of times pumping blood to every cell in your body. When your arteries become clogged, your heart struggles under an impossible burden, working harder and harder to force blood through narrowed passages. It deserves your care and attention now. When you feel chest pressure or shortness of breath, your heart is telling you something is wrong. Listen, address the problem. The exercise protocol I've given you works. It reverses plaque. It restores blood flow. It prevents heart attacks. Implement it starting tonight. Start your journey toward healthy, clear arteries. Take care of yourself. Your life depends on it.